Thank you for joining my presentation. Today I'm going to be talking about the invisibility and underrepresentation of Black nurses in the Canadian workforce. My name is Keisha Jefferies, and I'm a PhD candidate in the School of Nursing at Dalhousie University. I'm also a registered nurse, and I completed my master's in nursing in 2017. So just a quick overview of my presentation today. I always like to begin any presentation or conversation by having a personal location or situating myself, just really to share a lot of the ideas and origins of where my experiences do come from. The next piece will be the Black Canadian Nurse Pioneers, which is another segment that is important to this discussion. And then I will move into a bit of a conversation around my dissertation and finally some research projects that I'm involved in before ending with some nursing activism work. As I mentioned, personal location. I identify as an African Nova Scotian woman. I'm also a first generation university student, which means that I'm the first in my family to go to university, but also I'm the first in my family to complete high school as well. I completed a biology degree in 2010 before going on to do my Bachelor of Nursing in 2013 at Dalhousie University. After completing my BSCN, I worked for a couple of years in the neonatal intensive care unit at the IWK Health Center, where I was exposed to health policy as well as quantitative research, which is where I developed my interest in policy and research work. I then decided to go back to graduate studies, where I completed my master's, which involved a health policy analysis of breastfeeding practices in Tanzania. And finally, just one last piece of information. I am also a mom, so I have a beautiful 3-year-old who I gave birth to in the first year, the first semester of my PhD in 2017. These are just some of the funders who are supportive and also fund the research that I do. So just to highlight a few, so we have the Killam Foundation, the McCacken Institute, Research Nova Scotia, as well as Vanier. All right, so when we think about Black nurses in Canada, it's really important to consider the history of Black people and Black women specifically as they moved around in the Canadian history. So when we think about how Black women were involved in war efforts, we know initially that their participation was actually denied. So without being able to be included in the war efforts, the organized war efforts, a group of Black women actually formed something called the Black Cross Nurses, where they were providing care and first aid to a lot of soldiers as well as families during this time period. Additionally, when we look at the historical records, we see that Black people were not admitted to nursing until the late 1940s or early 1950s in Canada. And this is in contrast to what we know from the United States, where they began allowing Black people into their programs in the 1870s. So in Canada, we know that, while there were a lot of challenges and struggles in terms of racial segregation and slavery, it wasn't until pressure from community organizations and advocacy groups really turned the tides for nursing education and nursing training facilities in Canada. So oftentimes we do wonder, well, why is it that Black people were essentially banned from nursing until the 1940s, 1950s? And this has connections to racism and slavery in Canada. So we know that in the 1600s, we had an influx of Black people from the United States who were either fleeing enslavement or coming to Canada as quote unquote freed people. But this has really resulted in a legacy of intergenerational trauma that still persists today. So what we see in terms of the slavery history as well as the segregation, we see how that really has embedded itself in our educational institutions as well as our healthcare systems. So when we think about segregation, it doesn't necessarily mean that it was formalized in Canada, but rather we see it come through in very informal processes. So if we think about burials and cemeteries, oftentimes there are segregated sections for Black people and non-Black people in terms of where they're buried in a cemetery. Also, we see continued segregation with housing, and in our education system across Canada, we continue to see segregation based on learners and their levels of capacity and capabilities that are really tied to a lot of stereotypes of Black learners. So if we think about, concepts of new and old racism, uh, often people will talk about the fact that racism has really, it's not that it has disappeared, but it has transformed into a form that's more nuanced. So, people often talk about overt versus systemic racism, where overt is, the actual name calling or the direct discrimination. But then we think about the systemic processes. So those are the more embedded elements that it's more difficult to actually pinpoint, to call out, and to challenge. And finally, the last piece that speaks to why Black people were, um, less likely to be able to go into nursing in Canada and nursing in general is really related to the image of a nurse. And there is a growing body of literature that speaks to what a nurse looks like and who can actually be a nurse. So historically speaking, the image of a nurse is really tied to images of angelic figures, so angels, handmaidens, and it was also generally associated with white middle class women, whereas Black women, the stereotype was often um, flipped in respect to that. So Black women were often regarded as being more brute, lacking intelligence, and being lazy, which are not characteristics or ideals of the Victorian ideals of womanhood. So hence they were not viewed as ideal candidates to be a nurse. So we're going to do a quick spotlight on Black Canadian nurse pioneers. So the first nurse that I would like to highlight is Bernice Redmond. So she is a Toronto-born but US educated nurse who was refused entry into Canadian nursing schools. She received her nursing diploma from Virginia before returning to Nova Scotia, where she worked with the Department of Public Health in Sydney, Cape Breton. Also important to note that she is the first Black woman to be appointed to the Victoria Order of Nurses in Canada. Second and third, we have Ruth Bailey and Gwyneth Barton. This is not an image of them. This is from the Ontario Nurses Association. But Ruth and Gwyneth are the first African Canadians to earn diplomas from Canadian nursing schools. Again, they graduated from a Nova Scotian nursing facility, which is the Grace Maternity School of Nursing, which is now known as, it's no longer a nursing school, but it's known as the IWK Health Center. And they completed their nursing diploma in 1948. So again, thinking about the timeline of when nursing institutions were established in Canada and when Black people were allowed to enter nursing schools. And then finally, we have Clotilde Yakimkuch, who is from Cape Breton, which is in Nova Scotia again, so Whitney Pierre. She is the first Black graduate of the Nova Scotia Hospital School of Nursing, and she completed her diploma in 1954. And she was also the first Black president-elect of the College of Registered Nurses of Nova Scotia. And finally, she received the Order of Canada in 2003. So I do believe it is important to amplify the accomplishments and achievements of many of our Black nurse pioneers. And then finally, other notable women, Black nurses, Harriet Tubman, Mary Mahoney, and Mary C. Cole. So again, amplifying and lifting up Black nurse pioneers. Now I'm going to talk a little bit about my PhD research. And the working title of my dissertation is And Still We Rise, African Nova Scotian Nurse Leaders. So I will situate my PhD research with a little bit of background information. So it focuses on the population of African Nova Scotians, which are the Indigenous Black group to Nova Scotia. So these are the individuals that I briefly mentioned earlier who arrived in Nova Scotia in the 1600s, early 1600s, and they they migrated to Nova Scotia either enslaved or as freed people. Currently, African Nova Scotians comprise about 2.4% of the Nova Scotian population, so around 22,000 individuals. And the African Nova Scotian community brings together a very dynamic and rich history. However, there are a lot of socioeconomic challenges and social justice issues that remain and persist, but that is not the focus of this conversation. But also just to briefly highlight, that in 2014, the United Nations did declare the years of 2015 to 2024 as the decade for people of African descent. And then, as a follow up to that, in 2017, a working group from the United Nations traveled to Canada and conducted various focus groups across the country. And what they found was that African Canadians, so people of African descent who resided in Canada, continue to experience a lot of social injustice and human rights violations. And particularly in Nova Scotia, the African Nova Scotian population continues to experience these at much greater rates. So this is one of the aspects that speaks to why I've decided to focus on the African Nova Scotian community. The second piece is related to nursing leadership. So I conceptualize nursing leadership as a trait that is instilled through all levels of education. So whether it is at the practical nurse level, registered nurse level, or advanced practice level, all nurses have the potential and capacity to exert and be leaders. It's just a matter of tapping into various competencies and capacities in order to actualize that. As we know, nursing leadership and nurses in general have the ability to really cause a lot of transformational shifts in healthcare policy, as well as in healthcare reform in general. And then finally, when I talk about nursing leadership and the way I conceptualize it for my research, it's really looking at the idea of formal and informal leadership. So it's not just the formal roles that involve nurse managers or charge nurses, but also looking at informal aspects of like coaching or mentorship. So in terms of the literature and what is going on and what we really know to be the case in Canada related to Black nurses, we know that there are documented cases of racism predominantly in Ontario and Quebec. So notably, there are historic settlements where Black nurses have been awarded monetary awards based on discrimination and unfair treatment, specifically in Ontario. We know that oftentimes issues and racism discrimination is perpetrated by patients, colleagues, or even superiors. Oftentimes we hear of patients who say they do not want to be cared for by a Black nurse, or there are definitely situations and cases where Black nurses have reported being passed over for promotions based solely on the fact that they are Black. And then also, you know, there are countless undocumented, untold stories that we have yet to capture. We also know, based on the literature, that Black nurses tend to be concentrated in entry-level and non-specialty areas. So this would include maybe long-term care facilities and entry-level roles, but in also unlicensed clinical roles. So this would include your PCW, so personal care workers, or CCAs, continuing care assistant roles. And there's an underrepresentation of Black nurses in advanced practice, leadership, and specialty care. So when we think about specialty care, those would include ICUs, emergency and oncology units, and then advanced practice, which would be your more formal leadership roles. Finally, a bit of literature does speak to the idea and the concept that Black nurses feel as though they practice on the margins of the nursing profession, and they feel as though they're not really a part of the nursing core. So the state of the literature when it comes to understanding what it means to be Black in nursing or to be a Black nurse, we know that it's heavily dominated by American literature, and this is attributed to several factors, including the fact that the United States, they do have what are called historically Black colleges and universities, which are post-secondary institutions that essentially foster Black knowledge and Black scholarship and have nursing programs and education programs that are dedicated specifically to Black learners. We also know that the United States, they do collect race-based data, which is something we are advocating here for the sensitive and important use of race-based data. And finally, the other piece is the acknowledgement of the legacy of slavery and the intergenerational trauma. So one of the things that we do struggle with here in Canada is acknowledging our history and our connection to slavery and the lingering effects that it has on communities of color, specifically on Black communities. In terms of the Canadian research, we see that a lot of the literature is coming out of central Canada, so predominantly Ontario. And it also tends to focus on the immigrant nursing experience as opposed to the Indigenous Black experience or the experience of nurses, Black nurses who have been in Canada since the 1600s. So with that in mind, I'm hoping to address the gap in this evidence and, essentially the knowledge and information that is available regarding the experiences as well as the representation of African Nova Scotian nurses in practice as well as in leadership roles. So just to speak quickly to the purpose and objectives of my research, again, it's to examine leadership experiences of African Nova Scotian nurses in healthcare practice. And then the guiding questions involve how does race, class, and gender interact to influence leadership of African Nova Scotian nurses? And then finally, how do African Nova Scotian nurses perceive leadership? So how do they define leadership? In terms of the methodology, and this is, I won't bore you with the details, but I'm using a combination of Black feminist theory and critical discourse analysis. And essentially, Black feminist theory allows for the centering and positioning of the ideas, thoughts, interpretations, and experiences of Black women. It focuses on various intersections, including race, class, and gender, as well as others. And finally, Black feminist theory really takes a very collective approach, understanding what is happening with Black folks as a whole. And then critical discourse analysis complements Black feminist theory by incorporating a study of text and the use of language. So it will really allow for a breakdown and an understanding of what is happening in nursing as an institution, as well as in health and leadership as institutions. And finally, critical discourse analysis. It does allow for a collective analysis, but it also brings in individual elements as well. So you can really pinpoint and understand what's going on with individual nurses. In terms of data collection, so I have completed this part of my dissertation. So I conducted participant interviews over the phone using a semi-structured interview guide. I interviewed 18 African Nova Scotian nurses at the various practice levels, including LPNs, RNs, and APNs. And finally, I used a combination of snowball and maximum variation sampling. I am currently preparing to do data analysis, which again is informed by Black feminist theory, and will adopt the three-dimensional framework of critical discourse analysis. And this is just a quick glimpse of it. So just in terms of some current research projects that I'm working on, just to highlight some high-level stuff. Again, it's my dissertation research with African Nova Scotian nurses. An exciting piece that I'm working on with a great team is the African Canadian Nurses and Nursing Profession in Canada Scoping Review. So this is a scoping review that is being conducted in coordination with the Joanna Briggs Institute methodology. The protocol has already been published and it is available online. And essentially the purpose of this scoping review is really just to synthesize the existing evidence and describe how African Canadian nurses have been represented in Canada in the Canadian literature to inform knowledge gaps and identify areas for future research. So this scoping review is well underway. We are approaching the data extraction phase, and we're hoping to have the final report published within the next couple months. And then finally, I'm also working on a scholarly personal narrative, which essentially is a reflective piece on my own personal experience navigating graduate education, and it's guided by narrative inquiry and again, Black feminist theory. So these are just a few of the nursing related research projects that I'm involved in. The final piece that I'm going to speak to is nursing advocacy and activism. The first piece will be community of practice, followed by equitable admissions, and then abolition. So in 2017, I collaborated with the Global Health Office within the Faculty of Medicine at Dalhousie University to launch a student-led peer mentoring group for current and prospective nursing students. This is called the Community of Black Students in Nursing. The formation of the Community of Black Students in Nursing really emerges out of my own personal experience navigating undergraduate nursing, as well as feedback from numerous engagement activities with the Global Health Office, or PLANS, which is Promoting Leadership in Health for African Nova Scotians. It's an initiative within the Global Health Office that I encourage you to definitely take a peek at. So it's really designed to address a lot of gaps in the recruitment, representation, and retention of Black nurses or Black nursing students. And again, it's facilitated by nursing students and it's supported by the Global Health Office and plans. We have a number of objectives, which I will not get into, but they include personal development, research, mentorship, academics, professional development, but I will highlight community outreach. So one of the key elements that we are involved in is going into communities such as high schools and delivering presentations to encourage more Black learners to consider nursing as a career. These are just some of the events that we have hosted over the past 3 years. Now, moving into equitable admissions. So we have identified within the literature, there is a problem of the funneling or streamlining of Black students into alternative programs or programs that are below their capabilities. So we see this specifically in Ontario, where oftentimes Black learners are funneled into applied streams as opposed to academic streams. Where the applied streams really limit a lot of opportunities and possibilities for going on to post-secondary education. We also see this happen in Nova Scotia, where either Black students are suspended at higher rates or taken and put into other programs, alternative programs, which then again cut off opportunities for post-secondary education. So to address this issue, there are a lot of recruitment and retention initiatives that are, being implemented across the country. But, we see more happening in, I will say, Nova Scotia and Ontario, because these are the contexts that I'm more familiar with. But what we're seeing, for example, at the Faculty of Graduate Studies at Dalhousie, we have various advisory groups and advisory councils that are established to really address a lot of the barriers that Black students are facing to get to graduate studies. So these include financial barriers as well as traditional reliance on GPA as an indicator for admissions barriers, among others. And then the other piece is looking at the School of Nursing. So this is where I focus a lot of my advocacy and activism work. So I'm involved with numerous committees that are addressed at revising and redressing a lot of the admissions policy for the School of Nursing, as well as implementing numerous supports. A lot of my work is available online. So if there's any questions around, what we're doing at School of Nursing to move things forward and to assure that we do have representation in the school, that can be accessed through online as well. And then the final piece that I'll speak to is related to abolition. So this is the abolition of police and prison. Again, so as a nurse, as a Black nurse, it is impossible for me to talk about the idea of healthcare and community health without talking about abolition. As we know, police and prisons essentially are an extension of the enslavement or slave era, which is not necessarily designed to maintain peace, but it's more so designed to control Black, Indigenous, and people of color and control their bodies. So myself and my two dear colleagues, we drafted a position statement which has been circulated internationally, which collected more than 1,000 signatures of both nurses and allies. It's been translated into 3 other languages, French, Spanish, as well as German, and it has also been published as a letter to the editor in Public Health Nursing. So again, when we think about community health, the communities that Black, BIPOC nurses participate and work in, it is important to think about the role that police and prisons play in these communities and whether or not that is actually serving the health of the communities and the people. So with that, I will end there. So again, thank you for attending and listening to my presentation.